Hello, guys. So, welcome to the part two of the topic diabetes. So, this part two, like we said earlier in the end of the part one, we're talking about the causes of diabetes, living with diabetes, diabetic eye screening, and diabetic foot problems. So, I'll be talking about this in this part two. Please listen to the end as we learn from this. Generally, type 1 diabetes can develop quickly over weeks or even days. Weight loss is common in people with type 1 diabetes when it first develops and before it's treated, but it's less common in people with type 2 diabetes. Many people have type 2 diabetes for years without even realizing because the early symptoms tend to be general or there are no symptoms at all. Causes of diabetes. Let's talk about that. So what are the causes of diabetes? The amount of sugar in the blood is controlled by a hormone called insulin, which is produced by the pancreas, a gland behind the stomach. When food is digested and enters your bloodstream, insulin moves glucose out of the blood and into cells, where it is broken down to produce energy. However, if someone has diabetes, the body is unable to break down glucose into energy. This is because there's either not enough insulin to move the glucose or the insulin produced does not work properly. However, there's no lifestyle changes that you can make to lower your risk of type 1 diabetes, but you can reduce the risk of type 2 diabetes. But if you're diagnosed with type 1 diabetes, stick to your doctor's advice. There are people who are managing and coping well with it. That is why we always say early diagnosis is really important. If you're having symptoms that you don't understand, go for checkup and try to find out what's going on, because early intervention is really important, because if type 1 diabetes is left undiagnosed or untreated, it can lead to DKA. This means diabetic ketoacidosis, which is a life-threatening condition. So guys, let's talk about type 2 diabetes. One can reduce the risk of having type 2 diabetes through the lifestyle changes some have mentioned when talking about pre-diabetes. Consider things such as healthy eating, regular exercise, and achieving a healthy body weight. Quit smoking and cut down on alcohol. You may be more at risk of diabetes if you are living with overweight or obesity, if you don't have a healthy diet, if you have a family history of type 2 diabetes, if you take certain medications such as steroids for a long time, if you have high blood pressure, and if you had gestational diabetes during pregnancy. So these things can put you at risk, so just watch out. So let's talk about living with diabetes. If you're diagnosed with diabetes, you need to have a regular checks, including blood tests. So people that are diagnosed with type 1 diabetes require regular insulin injections for the rest of their lives. People diagnosed with type 2 can get worse over time. And people living with type 2 diabetes often need medicines, usually in the form of tablets or injections. However, some people can put their type 2 diabetes into remission. This is really important, guys. What is remission? This is when your blood sugar level reduces to a safe non-diabetes level for long term without the need of medications. So, and some of the things you can do is by losing weight, where blood sugar is reduced below the diabetes range. Some people are able to do this through a low-calorie diet, but this is not suitable for everyone. So it's important you get medical advice first. So diabetic eye screening is something that is really important as well if you have diabetes. If you have diabetes, your eyes are at risk from diabetic retinopathy, a condition that can lead to sight loss if it's not treated. The eye screening includes a 30-minute check to examine the back of the eyes. It's a way to diagnose diabetic retinopathy and detect the condition early where possible, so it can be treated more effectively. In many people, these checks can stop it from affecting their vision or reduce the chance of it getting worse. It is really important to see a doctor if you notice any problem with your eyesight, guys. Do not wait for your next screening appointment. Just see a doctor if you notice any unusual sign, please. Also, people with diabetes have feet problems. Diabetes can damage the nerves in the feet and can cause loss of feeling. It can also reduce blood supply to your feet. This means you may not notice if your feet is sore or injured. And foot injuries do not heal as well, so you need to be really careful with this. Foot injuries with diabetes can lead to ulcers, infections, and sometimes amputation can be needed in serious cases. Amputation is cutting off the leg. This might be needed in some serious cases. People with diabetes should have their feet checked every year by a healthcare professional, or if they think there's a concern. It is important to see a healthcare professional as soon as possible if you notice any problem with your feet, if you have diabetes. Anyway, guys, so this is my message for you today regarding diabetes. I hope we've learned something from this video. And I pray and I hope this video gets to someone that needs to hear it. Please be mindful of these symptoms I've mentioned. And if you notice any of them, see your doctor as soon as possible, because prevention is better than cure. And early detection is better than late detection. A lot of people I know are living with diabetes. They are living comfortably because they are going with the recommendations from their doctors. There are some that are just maintaining lifestyle. There are some that are already on medications. There are some that are on injections. They are still living healthy. They are still happy with their family. So early diagnosis is really important, my people. Don't take this for granted. If you notice any symptoms unusual, apart from even the symptoms I've mentioned, if you feel like there's something different in your body and it keeps coming, listen to that inner voice and go for a checkup, because it could be a symptom of something coming up. And sometimes some are curable, while some can be prevented from getting worse if detected early. So guys, please, let's take our health very important, because health is wealth. If you go to hospital, there are a lot of people crying. They want to be home. They just want to be home. They don't even care about the money, the cars they want to drive, the duplex. No, they just want to go home to be with their family. They are tired. They are tired of being sick. They are tired of being in the hospital, from taking one drip to another, from the injections and all the bruises in their body, from the needles and stuff. They are just being tired. They are just tired of being sick. So that is why it is said that health is wealth. When you're healthy, you can be wealthy. Even if you're wealthy and you're unhealthy, my dear, it is suffering. Now who they alive, they find money. Now who where, now they hustle. That's why we need to take this health advice very seriously, because they are important. We need them for ourselves, for our loved ones, our parents, our children, our neighbors, for anyone that it could be helpful to. Please, let's spread it. Let's share this video. Let others know about it. Let others hear about it. A lot of people's legs have been amputated, cut off, just because they couldn't do some things right. Some could have been prevented if only they were aware, because information, they say, is power. If they know about these things on time, early detection, preventing the legs from injuries, raising alarm on time when you notice anything, those little things would have prevented some people from having their legs cut off, amputated. So please, guys, let's share this video as much as we can. Share to WhatsApp, your story in Facebook, Instagram, TikTok. Just share it. Share to your family members. Let them listen to it. And please, guys, feel free to ask questions in the comment section. I'm happy to answer your questions as much as possible. So please, let's share this video. Let's make it go viral. Let people know about this. For anyone suffering from diabetes already, I'm telling you, it's not a death sentence. It's not the end of the life for you. Trust me, this can be managed. Just listen to the advice from your doctor. If you feel like you're not seeing enough improvement, or you feel like your doctor is not managing it properly, my dear, try another doctor. Just follow the right advice. Go with it, and trust me, trust the process. You will see that you're coping well with life and you're living through it. So that's my advice for you today. I wish all of us good health. I wish for God's mercy upon our lives. I wish for divine healing for those that are sick. And I wish for continuous divine protection for us all. Please, guys, share this video. Let it go viral. Bye for now. I love you all. Bye.